Welcome back to Living with No Excuses. I'm Noah Galloway, your host, and this is where we get to meet amazing people who are doing and have overcome extraordinary things. Today, I'm excited. We actually have someone in the studio. She lives about an hour south of here, Gini Thomas, and she has an amazing story. Jenny, tell us, how was the drive in?
The drive was fine. No major traffic issues. So we
Yeah.
we did this at the right time. If we had done it any earlier, I would have hit traffic.
Yeah.
So we're
So,
good.
okay. So, are you from Montgomery?
From Montgomery, born and raised. I did live in Athens, Georgia for about 4 years, but
Yeah.
yeah, Montgomery girl.
Okay. So, born and raised in Montgomery. I go through there a lot going down to Columbus, Georgia,
Yeah, yeah.
to the National Infantry Museum. I'm a board director down there. So, we have meetings and I drive through Montgomery a lot. Let's go ahead and jump right into what happened.
How did I get here?
Yes, yes.
So yeah, my senior year of college, I met a guy who was playing in a band at a bar. His name was Joe, and we hit it off immediately, ended up dating for 3 years, eventually got married. We'd been married exactly 17 months to the day, and we were getting on the motorcycle actually to head up to this area, to Columbiana, to visit his mom. And we had just left our house taking the safe route. We did not get on I-65, and a guy pulled out from a side street, ran a stop sign, and hit us. And Joe was killed instantly, and I broke every bone in my right leg in every single place that you could break it. I saw the car coming at us and just didn't have time or really anywhere to bail out with the way the traffic was. So we got hit. I blacked out. I came to sitting in the middle of the street with my femur sticking straight up through my jeans, bones sticking out in other places. And I consciously thought, okay, well, that's probably gone. And also, wow, I didn't realize bone was that yellow. I thought it would be more white. It's like the crazy
Yeah.
thoughts that you have. Um, and then I looked up from that and I saw the motorcycle and looked up a little bit further and I saw Joe and he was face down. His helmet was still on. Mine had been knocked off. His eyes were kind of half open. His tongue was hanging out and I didn't see any movement at all. And at this point, somebody was next to me wiping blood off my face, and I kept saying, "Can you go check and see if my husband's breathing? Doesn't look like he's breathing. Can you just check on him?" And nobody ever did while I was still on scene. I think they had checked on him before I
Yeah.
regained consciousness. Um, so just the way the conversations were happening around me, I realized that he was probably dead. It took 5 medics to load me into the ambulance, not because I'm a heavy person, but because my limb had actually been detached at the hip as well as all of the fractures. So they were trying to keep it from falling completely off my body. Once they clicked me into the ambulance, that's when a switch flipped and I started feeling pain.
Yeah.
And a needle went in my arm there, and I was out for a week. I was on a ventilator. They initially stabilized me at Montgomery at Baptist Medical Center South, just washed everything out, put external fixators on, and shipped me up to Birmingham the next day. I had 2 more surgeries before I was off the ventilator and conscious. Woke up and was shocked that I still had my leg. And my surgeon was there that day. It was a Sunday. And he came in, sat at the end of my bed, and said, "I'm here to answer whatever questions you have." And I said, "You really think this leg's going to work again? Like, I saw how
Yeah.
bad it looked. This is really going to work?" And he said, "Well, I think you have about a 60% chance of being functional with it." But see, everybody else didn't know that I already knew Joe was gone. So in their minds, they're thinking, we can't have her wake up and realize her husband and her leg are gone. So let's try to save it. So he had put in a lot of effort already. Everybody else seemed to think that was the right thing to do. So I was like, all right, let's try surgeries and see what happens. So I did limb salvage for 3 years, bone graft, muscle graft, tendon grafts, like infection after the seventh surgery, PICC line, get rid of that. They can't say for sure infection's gone, so they kept me on oral antibiotics all this time. Pain medicine, muscle relaxers, antidepressants, just I had a whole pharmacy.
Yeah.
And I still wasn't functional. Even with all of those surgeries, I never progressed past walking with a cane, and every single step was excruciating.
Yeah.
Even with all the medication. So I finally decided this isn't doing me any good. I need to look into other options. And about this time,
Now, how long has this been since?
so like early 2015, because I had a total knee replacement in 2015, and I was thinking that might fix me.
Yeah. No, I mean, how long from the,
Oh, the wreck? It was 2012.
no,
Sorry.
until you were like, okay, let's look at something different.
It was about the 2-year mark.
Okay.
Yeah. And I had seen several different surgeons, had one that agreed to do a knee replacement. My knee had really been trashed. And so in my mind, if I fixed the knee, maybe everything else would be functional. And rehab from that wasn't easy and it wasn't going well. Your season of Dancing with the Stars happened to come on. And I don't know if somebody told me that there was going to be an amputee on that season or if I just saw a promo, but I was like, let me see what this guy does. So I watched and I saw how you moved, and I knew it wasn't easy, but it looked so much easier than what I was dealing with every day. So I actually had my mom watch it with me, and I was like, do you see this? Like, I'm pretty sure I'd be better off if I just get rid of this leg. So started talking to my surgeon about it, and he really wanted me to be sure. He had me go see 3 other doctors, sit down and go through all the
That's a big
questions.
decision. I mean,
Huge.
we know otherwise now when you've been there, done
Yeah.
that, but in the beginning,
Yeah.
you had to optionally say, I want this removed.
Right. It's a big decision. I didn't have to have a psych eval for it, which I thought was weird.
I thought that's where it was going to go. I thought you were like, you sent me to go.
No psych eval required, but he did have me talk to nerve surgeons, other orthopedic
At
surgeons
least know your knowledge of what you.
and make sure that I had really tried everything, make sure there weren't any other viable options at that point. So everybody was kind of on board, like, yeah, what you're dealing with is going to be painful and a mess forever. If you cut it off, you'll be in better shape. Now, they did tell me, since I had such extensive nerve damage and since I'd lived with nerve pain for so long, that I might struggle with nerve issues even after amputation. Phantom limb pain might be a serious thing, but they still thought I would be more functional. So agreed. Everybody agreed. I had the amputation in August of 2015. So August 2012 was the wreck. August 2015 was amputation. August is a big month.
Yeah.
Got it done, healed up pretty well. Initially, I had a really long limb. They just went a couple of inches above the knee. They left the IM nail that was in my femur because my femur was still pretty weak from the fractures. And the thought was, as I started weight bearing more,
You would still get stronger.
that the bone would get stronger. Well, that doesn't always happen in a socket.
Yeah. In fact, the socket's supposed to deter there from being a lot of weight.
Right. So after about 1.5 years, I started getting a lot of pain at the distal end of my limb. I was really active in my socket. Would have bruising at the end. I'd get, skin breakdown like you do. The sweat was an issue. We live in the South.
There's nothing worse, though, than a sore on your stump
Yeah.
when you're trying to walk on it.
Yeah. And then, you can't use it for a couple days. You got to let it heal. So even though I was successful with the socket, I still had those struggles. And eventually I went for an x-ray because the pain at the end was so bad. And we saw that the bone had actually started to deteriorate at the bottom. So I had the jagged metal of that IM nail
Pushing.
digging into muscle belly with every step. So went in for my 13th surgery to have that hardware removed. It's brutal surgery. They opened me up at my hip and at the distal end and just basically beat it out of me. I felt like I'd been run over again when I woke up from that surgery. Started healing from that, tried to get back into a socket, and I was having the same pain at the end. And now I had started to develop heterotopic ossification, fancy word for bone spurs, had a big hook growing at the end of my femur. So went in, had surgery to revise that. A few months later, the same thing happened over and over and over.
Now, did they ever tell you what the reasoning behind that bone growth was?
Yeah, so apparently it's very common with trauma, when there's a traumatic
We saw, yeah, there was
amputation.
like, I had it, all the guys, and there were two females that were at Walter Reed when I got injured. That was a big issue, was bone growth.
It's even more common if you had a head injury at the same time.
Really?
So I did have a traumatic brain injury. My helmet had been knocked off
Yeah.
in the wreck. Luckily, I don't really have any major deficits from
Yeah.
that.
And I was going to say, when you said earlier that your helmet was off, I'm
Yeah,
like, it could have been.
it was TBI for sure. And I'll blame stuff on that still.
Yeah,
Like if I forget
TBI.
somebody's name, I'm so sorry. I had a TBI, you know? I can't be held responsible.
Yeah.
Yeah. So yeah, I kept struggling with those bone spurs. They would come back every single time. Every time I had surgery, it was making my limb shorter and shorter. So early 2020, it was February 2020, I had one more revision and then another spur started to grow. And my surgeon said, I can't cut away anymore ethically because I think you might be a candidate for osseointegration. It's not FDA approved yet, but I think they're close. You've been living on crutches for years
Now,
in
say-
between.
now explain to us what that is.
So osseointegration is anchoring the prosthesis into the bone instead of using a socket. So with my short limb, I really wasn't able to successfully or comfortably keep a socket on my leg unless I wanted to use belts
Well, yeah.
and or some kind of suspension system that was extra. And again, living in the South with the heat,
Extra
wearing one of those
doesn't-
belts with the Velcro and it's rubbing all against you. And I was just like, no, I'll live on crutches. So I did have life figured out on crutches. I knew what I was doing, still living alone, taking care of my dog, taking care of my house, getting all my own groceries, doing everything that I needed to do, but I knew it could be better.
Yeah. So the
So-
doctor mentions this surgery.
He did, and my surgeon at the time was not doing this surgery. There were clinical trials going on. He's like, if you can just hold on for that FDA approval, your insurance will cover it then. So actually later in 2020, the Integrum Opera implant system did get FDA approval for above the knee transfemoral use. There was a program starting up at Emory in Atlanta, so not too far. I had a friend in the prosthetics industry in Atlanta who reached out once that program was up and running, and he's like, have you thought about this? I know some people, I can help get you in. So I went for a consultation in March of 2021, and they do x-rays, they send you for a CT scan, they're checking the overall health of the bone, making sure you have enough thickness there, which it was close for me because after 3 years of not using it, not weight bearing, not doing anything with that bone.
You could have not have qualified.
Right.
Yeah.
Like I was losing bone density from not using it.
Yeah.
So close to being osteoporotic, but they actually took the CT scan of my leg. They 3D printed several models. They did test runs of the surgery, ran all kinds of tests on the implant in the model to make sure things were going to work. So it took from March until October of 2021 before they said, okay, you're a candidate, we'll move forward with surgery. So it's a 2 surgery process. If you're familiar with how dental implants work, it's the exact same thing. Actually, the guy who invented dental implants, his son is the one who furthered the technology.
So they
for
throw
implants.
an anchor in first?
Yes.
Okay.
Yes. First surgery, they're putting an anchor, they call it the fixture, in the bone. They do a little bit of bone grafting at the end, place a healing cylinder, and close you back up. You come back about 3 months later. For me, it was 4, just a little extra healing time. And then they attach the abutment, which is the metal piece that sticks out. They do all the soft tissue work. They actually are able to score the end of the bone and then attach skin to the end of the bone.
Really?
So it heals pretty clean.
Yeah.
You have less of an opening there, less of a highway for things to get inside. Still got to clean it every day. I mean, I say it's like a piercing. You want to keep a piercing clean to prevent infection. I just clean it with soap and water in the shower.
Now, okay, so they put the base in, the anchor, and then if you'd have had a longer residual limb, do you think you could have walked with a socket, or is it just like, no, this has got to heal, no pressure on it?
Some people do go back into a socket
Yeah.
in between. I think it was more common like back around COVID time when
So you might as well
surgeries
sit
were more
around,
spread out. Yeah. So there's actually another guy I know who had his first surgery and then COVID hit and it was up in the air when he would have the second one. So he went back into a socket
Yeah.
and was fine. It's the first surgery is really more like a revision surgery than anything.
Okay, so
Usually in that first stage, they're not even doing anything with the soft tissue. They're just putting the anchor in the bone and closing things right back up. I had a pretty small incision from that first surgery.
Okay.
So if I was using a socket before, I technically could have gone back into a socket in between.
Now, was it sore?
Yeah, it was sore.
Yeah.
I was bruised pretty heavily
Yeah.
after that first surgery, but nothing major. They did tell me to be really careful in between the two surgeries. They wanted me to use a wheelchair that whole time, which I do not enjoy sitting. So I complied for about a month. And then I showed up for one of my follow-ups on crutches, just hoping nobody was going to yell at me.
Yeah.
And nobody did. So
Probably terrified
Yeah.
you're going to fall and slice it.
yeah, they don't want you to mess anything up in the interim.
Okay, so you go back in, they put the rod in,
Mm-hmm.
and like you said, they're able to kind of almost fuse the skin to the rod.
To the bone.
To the bone. So so it curls back in.
Mm-hmm.
Okay, that makes sense. All right, how long was that? Because I met a guy in the airport one time when I first saw someone out and about. Like I met someone who had it done at Walter Reed probably about 2010.
Yeah.
You know what I mean? They were still experimenting
Mm-hmm.
with things. Now, the guy I'd met in the airport was in the last year, and I was pretty impressed. But he says his leaks constantly with infection or anything going on.
I did have a fair amount of drainage for about the first 6 months while things were healing. And I've had a revision surgery just over 2 months ago for neuromas on the sciatic nerve. So I've had a little bit of extra drainage since then, just as swelling and things settle down. Sometimes when I fly, for whatever reason, I'll get a little extra fluid there. But it's all like this clearish interstitial fluid.
Yeah.
It's not like pus or blood.
It's not flowing
or
out
anything.
like
No. No. Now, there are other implant systems out there. All the other implants cover the end of the bone, so the skin can't really heal to anything there. So they sometimes will have a little bit more drainage, just because of the way things heal. But then I know people with those implants who don't really have issues with drainage. It seems to be just an individual thing. Like every body is different. Like I've had it over 3 years now and I haven't had a single infection.
Okay.
Some people struggle with infection. They're just more prone to it.
Well, what was the time frame of when they first told you use your wheelchair until you got the rod put in and you were able to walk around a little bit, and how long until you were like, okay, I'm back in?
It was a longer process for me. So from first surgery to second surgery was 4 months instead of 2 to 3. And then once your sutures are out and things are healed from that second surgery, they let you start the weight bearing phase. So you have to start out at a pretty low weight. They just fit you with like a stubby almost, a short limb that goes only to about your knee. They don't want you to attach a full prosthesis because you'll be tempted to put it on and go, and I 100% would have. So you have a scale, you have the short one, all you're doing is shifting your weight over onto it.
Yeah.
Now the protocol paperwork said start at 40 pounds, add 10 to 20 pounds a week until you're at 80% of your body weight, and then you can attach the full leg. And I'm like, heck yes, I only weigh 100 pounds. This is going to take me like 3 weeks to get there. Wrong, because I, again, had not done anything in 3 years.
Oh, yeah.
All of the muscles had atrophied. The bone was very, very weak. So I started out at 40 pounds on that first day. And then the next day, I could hardly move.
Yeah.
I was in so much pain. So I had to start back at 5 pounds, just barely putting 5 pounds over it. It took me 3 or 4 months to get to 80% of my body weight. And then I started attaching the full leg. It took a few more months to get used to that. So from the second surgery to walking unassisted was about 10 or 11 months for me.
Oh, wow.
I've seen some people back fully functioning 100% in as little as 6 months.
Really?
It's a very personal, individual journey. Some people might take 2 years to get to that point. I know one guy who's still using forearm crutches several years later. He has a lot of issues with CRPS though.
Yeah. But that's the thing is, like, that's when I talk to people about disabilities, I was like, there's no way to fit us all into the same.
No, not at all. It's
so complicated.
Such an individual thing. So it's different for everybody.
So how long has it been?
It's been just over 3 years now. So January of 2022 is when I had the surgery completed.
When did you realize you were over the hump? Like you were in this. This is like, okay.
It was about November of 22, I
Yeah.
think. I've had some setbacks. I've had revisions for neuromas since then. I was not following the rules in summer of 23, and I stepped in a hole at the beach and tore the labrum in my hip. So this system, the connector, comes with safety features. It's got a breakaway for too much flexion. There's also a safety breakaway for too much torsion, and that's to prevent
Yeah.
injury.
Yeah.
So it's not fully waterproof though.
Mm.
So I put on a different connector to go to the beach, and I was
It
using
breaks through.
that connector has no safety features.
Oh, so you stepped
In a hole, tweaked my hip, tore the labrum in my hip. Took me several months to get to a surgeon who would listen to me about it. Everybody immediately was like, no, it's probably an issue with your implant. So they just kept running tests on the implants.
You're like,
That's not showing
yeah,
anything.
yeah.
I kept requesting an MRI arthrogram. I'm like, no, it's in my hip, I'm telling you. And my surgeon at Emory wouldn't do it. Finally, just told me to go somewhere else. So I did. I now see a team up in Charlotte. Dr. Joseph Shue heads up the team at Atrium in Charlotte. He listened to me. They did the arthrogram, torn labrum.
Yeah.
Had that repaired in November of 23. Rough rehab there. Had another revision in February of 23. No, March of 23. 4. All the surgeries run together. I had a nasty neuroma then. Thought that was going to be the last one. Somehow or other, I regrew another one. So I just had that repaired February 18th of this year. And
It's been a lot.
it's a lot. I've had 24 surgeries on this leg now. Amputation was 12, so I've doubled that.
Yeah.
But I'm way more functional now than I was before. So,
Yeah. So what do you do now? So I mean, what is it? What is your life like now?
Now I actually do work as a patient ambassador for Integrum, the company that makes this implant. So I travel a lot, helping to educate people about it. I'm also a brand ambassador with Ottobock, the company that makes my knee and my foot. So I get to do events with them from time to time. Personally, I'll go and speak at physical therapy schools, prosthetic schools, trying to teach the next generation and educate them about this
I
option.
go to physical therapy. They said they had you.
Oh, really?
Yeah,
No
they said
way.
they've heard you speak.
No way. That's awesome.
They still remember. They enjoyed it.
Yeah, well, good. I'm glad. I'm glad. I mean, my goal is to educate people about this because, so especially in Alabama, there are so many people who don't even know that osteointegration is a thing. They don't know it's an option. I had a guy on Facebook who's an internal medicine doctor comment last week or week before, I've never seen this before. Do you have to take anti-rejection pills? Like, how do you deal with this day to day? And no, you don't have to take it.
That's something that's come up when I've talked to other people because I don't know anything about it.
Right.
I just know it's a thing.
Right.
And that has been a discussion. Like, I wonder if you have to take something.
Do not. Do not. People think that you have to stay on antibiotics for the rest of your life. No. If I were to have a superficial infection, a course of oral antibiotics should knock that out.
Yeah. But it's not something you have to constantly be doing.
No, and they tell you to expect a superficial infection once every couple of years. You know what to look for. You know what to do to treat it. The instance of a deep bone infection to the point of removal is like 8% or less. So it's a lot lower than people
I got
think.
and to people who aren't amputees, they may not fully grasp it, but how nice is it to, even in the middle of the night, to just click a leg on?
It's amazing. I used to keep my crutches by the bed because I would not.
It takes too long to put it on.
I wouldn't get up, put a liner on, put a sock on, put my leg on, then go. I would just use crutches. Now my crutches live in the closet.
Yeah.
I don't use them. It takes seconds to take
that's
this
one thing
off.
that I'm like, that is a
Put it
game
back on.
changer. Because it is like, even if I'm trying to hurry up, this is too much information, but when I wake up and think I've got to pee,
Yeah.
and then usually I would just hop, but I'm like,
Yeah.
I'll put my leg on.
Yeah.
It's like my body knows that I'm resisting it, and I'll almost not get it on quick enough.
Well, or you put it on wrong. Like
Yes,
it's twisted
you
to
gotta
the
adjust it.
side, and then you got to try to wobble around with it. This goes on the exact same way every
Yeah.
single time. You don't even have to think about it. Everything's
How does it
aligned.
click on the same?
So the implant it's kind of a square.
Oh, okay.
And
So it's
then-
facing a certain direction. Got it.
So this will, of course, everybody's implant is going to orient differently once
Yeah.
they get it torqued
But once
to
they get
spec.
it in the right
Yeah,
spot.
and you just align everything so it goes on the exact same way every single time.
Yeah. Still see the same process?
Yeah, I've had the same prosthetist since I started the osteointegration journey. Actually, there was a guy in Atlanta who had done his training out in California and had trained under Dr. Brandemark at one point. Brandemark's the one who invented all of this.
Yeah.
So I was like, oh, that's my guy. That's gonna be my guy. And he's been my guy the whole time. He's a younger guy. But since he trained on this, I was like, yes, that's who I'm working with. And he's still learning too. We've had a lot of fun learning together. And I think he's got like 8 or 10 osteointegration patients now. So.
Now, you were just at, was it this past weekend? Where were you?
I was in Golden, Colorado at the Limb Preservation Foundation's yearly symposium. It's a great event. They have lots of breakout sessions with information for patients. They see a lot of cancer patients, a lot of trauma patients, people going through limb salvage, trying to keep their limb, but they have doctors who are on the cutting edge of research. So they have lots of information to help preserve a limb, but if you do have to amputate, they're trying to educate people.
How many people did you come across that had this done?
That had this? I think there were maybe 6 of us there.
Yeah.
With osteointegration.
How was everybody else's experience?
Pretty good.
Was there any negative ones? Was there anybody that was like, oh, I'd regret this?
No. No. And I've talked to a couple of people who have had their implant removed. I've also talked to some who've had it removed and re-implanted.
Okay.
So it's kind of a mixed bag, but more often than not, it's a positive experience.
Yeah, because that's one thing I try to explain to people. I was like, to not have a liner and a socket on.
It's pretty freeing.
Yeah.
For working out, especially.
Yes.
Like I work out at HotWorks. So everything I do is
hot.
in a 130-degree infrared sauna. I'm sweating.
That will just build up sweat.
My leg would never stay on.
Yeah.
No way. It would fall off in the first 5 seconds.
Yeah. That is awesome.
It's a game changer.
Well, let me ask you this. So about 12 years, has it been about 12 years?
Let's see. Since my amputation, I'm coming up on 10 years. The injury, it'll be 13 in August. Yeah.
Yeah. And that's a lot to unpack. We won't do it all here, but what have you done and I asked this because I was in denial for a long time when I got injured. Did a lot of crazy, like I was just trying to just not feel my feelings. So I was just destroying my body. And it wasn't until I started doing mental health work that I started to realize a lot that I was denying myself from dealing with. Have you had any of those experiences? What do you do for your mental health? Like, that is a lot to take on.
It is. I struggled way more with the loss of Joe than with my leg. I've had people ask how I coped with amputation, and I never really had an issue with cutting my leg off because I'd already lost the most important thing. So that was the bigger struggle for me. Actually, I did start seeing a therapist pretty soon after the wreck. The first one quit. I think I broke him. After like 3 or 4 visits, his secretary called and said, yeah, he's decided he's not going to treat adults anymore. So I had to find another one. That next one just kept giving me pamphlets to read, and that was about it. And I finally got to a lady who helped me a lot. And then I think once I got to the point of amputation, that gave me a little bit of closure too. Just being able to put all of that behind me. I wanted to keep my leg. I talked to my surgeon about options on that, and he was like, Jenny, you're insane. No, you cannot keep your leg. And then I explained more. I said, well, no, I want it so that I can.
Wait, when you say keep it.
I wanted to get it back from surgery.
Okay, I knew. Okay, at first I thought you meant you just wanted to keep it attached.
No. After the amputation, I wanted to get it back.
Okay.
So we finally reached an agreement where a funeral home near the hospital cremated it for me. So I got the ashes back, and I was able to take those leg ashes to Joe's grave. He's buried in Dothan, Alabama. Joe's dog, Bo, that he had before he knew me, passed about a year after he did. So I took Bo's ashes, I took my leg ashes, went down to Dothan by myself. Left everything there, had a good cry.
Yeah.
But that was a big moment of closure for me. Like, okay, let's try to move forward now
Yeah.
with this new outlook.
Which is difficult.
Yeah,
And
it is.
one thing you said that I was hoping that's where the story would go. It's not uncommon to come across a counselor, a therapist that you just don't connect with.
Oh,
And there's not,
yeah.
a lot and counselors aren't ever bothered by that. They want you to
Right.
feel, and some of them realize they may have just gotten in over their head with things. You know what I mean?
Yeah.
And that's fine. But I'm glad you stuck with it to you. Because there's two things I found in my experience. One, you got to be ready.
Yeah.
And two, you got to connect with that person.
Oh, yeah, for sure.
Because I saw many a therapist that, I would put on a show. Didn't even know I was doing it. And then
Yeah.
they'd be like, you're doing really well. You sure you should be here? And it wasn't until finally I connected with that right one that I'm like, okay, I can't wait for my next appointment.
Yeah. Yeah. It makes a difference. It
Yeah.
really does. In the beginning, I just wanted somebody who was impartial, who didn't know anything about the wreck, how it happened, because like talking to family members about it, they were already so emotional themselves.
Well, it's just like going to a funeral. You're like, what do
Yeah.
you say? Do you say the same thing everybody does?
Yeah.
Yeah.
And everybody else had their own opinions about what I should be doing and the best thing for me to do next. And I was like, I need somebody who doesn't know anything about me at all.
People mean well,
They
but it's
do, yeah.
overwhelming. That's like when I get a call, and I'm sure you've experienced this. Someone's like, oh, will you go talk to, and I've gotten to the point where I'm like, I'll go talk to him, but this just happened.
Yeah.
So, I'm going to tread lightly.
Right.
And then if they want to talk more later.
I'm the same way.
Because when I was at Walter Reed, there were tons of people that came through, great organizations, great people. But when all I was thinking was getting out of there, I wouldn't, I was trying to, like I said, I was avoiding dealing with stuff. So it was like when I left, I didn't keep track of any resources that they gave me.
Yeah.
Because it was all just jam packed, and they mean well, but it's just too much.
Yeah. It's overwhelming.
Yeah.
For sure. And there's so much information out there, and you don't know what's legit and what's not. And now there's all these Facebook groups, and you can try to read through stuff there, but half the people don't even know what they have on, but they're trying to tell you that's the best.
And that's what I love about your social media is you do really well being an advocate and letting people know. That's why I was excited to have you on, because I've been so intrigued by this.
Yeah.
And I wanted to talk to somebody directly. It was when I met that guy in the airport, and then we didn't have a lot of time to talk, but I had so many more questions. But yeah, your social media is really good of following your progress, what you're doing. You stay active. Look like you did some, I'm sure obviously wasn't your first time, but would y'all do like some modeling?
Oh yeah, I've done a little bit of modeling.
Yeah.
Yeah. The photo I just posted.
Oh, that was a flat. Was that from
That was from a fashion show I did back in November.
Okay. All right. Yeah.
Yeah.
It all happened at the same time when I saw it.
Yeah.
Yeah.
Yeah. That was my first time on a runway, and I was not supposed to walk in the swimwear line. I was originally just in a line that was fully clothed, and an hour before the show,
They're like changing things up.
well, the designer for the swim line was like, "Are you walking in swim?" And I said, "No. Do you need somebody?" And she's like, "You're walking in swim.
Oh,
Come here." So she immediately put me in a swimsuit, and I was like, "Cool. I guess I got to do a quick change in the middle."
Yeah.
So yeah, but I was the only amputee walking in the swimwear line, which was incredible. And if there's a video that I can go back and watch, and hearing the difference in the crowd from everybody else walking, and then I come out, and you can hear it get louder and louder and louder.
What an awesome
It was a really, really cool moment. I was so happy I got to do that.
So your social media, what is your Instagram? It's Slim Gini.
Slim Gini, SlimGini. My father-in-law always called me Slim. So when I created Instagram, I've always been thin. Like people have called me Skinny Jenny my whole life. One of my friends at this conference last weekend, her husband was calling me Thin Jen. So there's a bunch of nicknames that go with it. But yeah, I've always been pretty slight.
Yeah.
So Slim Jenny. I had that account before my wreck. I thought
you were gonna say you had it before Eminem.
Oh yeah, no. Well,
I started this. He stole it.
I think of it like a Slim Jim. Snap into a Slim
That
Jim.
makes way more sense. But when I look, every time I look at it, I think of Eminem. All right, so yeah. So before we go, I like to do this thing where with the guest, I had come across this deck of cards. Sometimes we just pull up things random. Sometimes we use the card, but they're in different levels.
Okay.
So the first was level 1, icebreakers. Level 2, confessions.
Ooh.
Level 3, getting deep. So it may get a little more. So now I don't know what any of them are,
All
what
right.
it's going to be. Uh, and we'll go through one of each together. That's okay.
Okay. Let's do it.
All right. First one. What emotion do you find most tricky to express?
Grief,
Yeah.
for sure. I think because everyone grieves differently and everyone has different expectations for it. And people want to think that you're doing it in the wrong way.
But do you think you're doing it the wrong way?
No, I don't think there is a wrong way,
Yeah.
but there are people who will judge how you grieve,
Yeah.
for sure.
But the question is, what's the one you struggle with the most? Like, if you feel like you're doing it the right way, do you worry that your grieving isn't on par? Do you compare?
I think I struggle when I'm happy and feeling good, and then I click back to, oh, should I not be feeling happy right now?
Mm,
Like, still a sad situation, but actually today's a really good day.
yeah.
Is that bad? Like, if I don't break down and cry on the anniversary of the wreck,
Then you feel guilty.
is
Like
that bad? Am I doing this wrong? And there's good and bad can coexist in grief.
Yeah.
You can hold on to the love that you had and you can still move forward in a positive way. It doesn't have to be all bad. It doesn't have to be all good. And I think realizing that you can have those together is hard to come to grips with.
Yeah. No, that makes perfect sense. Mine's always been showing being vulnerable and crying,
Mm-hmm.
which I've worked really hard on and improving because I'm 43 at 40, and even probably not that long ago, I could probably be more accurate, but I realize now when I lose my temper, when I pitch a fit, you know what I mean? I am going back to being the child that was denied expressing their emotions,
Yeah.
and it comes out as
Yeah.
anger. And it has been so much better when I've started learning to let it out,
Mm-hmm.
because then I'm a little more balanced. I always tell people, if you suppress one emotion, you end up suppressing all the emotions.
Yeah.
Because I was bad about being told by people, do you not get excited about things? Like I knew how to put on a show, but then not to change it was either just baseline or anger.
Yeah.
And that was just because I wasn't crying.
Yeah.
Yeah.
Funny how that works.
Yeah, it is. Yeah, right. All right. Level 2. What is something you will never do again?
Ride a motorcycle.
Yeah.
I have been back on a bike one time since the wreck just to prove to myself that I could do it. But I tell everyone the things I saw that day and the emotions I felt, plus knowing the way my parents felt when they got the phone call, I don't ever want to cause anybody to experience that because of me again. I miss riding. I really do. I loved it, but it's just not worth it to me anymore.
No, it's, and I'll admit, like I have a motorcycle. A lot of the guests I've had on the show has been, and I tell people, I was like, usually if I meet an amputee that's not military or a diabetic, it's usually a motorcycle accident.
Yep.
And I have a son that rides, and it stresses, it's like I know he enjoys it, but I know the dangers. And my uncle, who's ridden motorcycles forever, he's like, they say if you ride one long enough, you're going to die on one.
Yeah.
And it's one of those things that with my older son who rides, when he was younger, I was so adamant about, you have to watch. No one else sees you.
Correct.
They say, I remember reading about a study a long time ago that your eyes and brain can only take in so much information. So it pushes away what's not important.
Yeah.
And if you don't own a motorcycle, if nobody owns a motorcycle, well, the brain is not going to see you.
Right.
Because you don't register in their mind. There's too much information coming in.
Yeah.
And so accidents happen.
Yep. That's such a good point. Now, anytime I'm riding and there's a motorcycle around, like especially on the interstate,
hyper-aware.
oh my gosh, and it makes me nervous. And I try to give them so much space, and I'll even start blocking for them. Like I get defensive for them. 'Cause
Yeah.
It makes me so nervous. I just don't ever want to see that happen.
Yeah. No, it's and when you said, y'all were taking at 31 up.
We're taking the safe route.
Yeah. Yeah. It could happen anywhere. All right. Number 3.
Going deep.
All right. Here we go. What beliefs have helped you stay strong in life?
My faith has been hugely important. I am a Christian. Um, Initially, I was questioning everything, of course, like, why would God even let me meet this person just to yank him right back out of my life? Why did I live? There's no reason I should be alive and he died.
Yeah.
Like nothing makes sense. And it took my mom staying positive and staying in my ear about everything, even when I didn't want to hear her. And it took time to really see why I am still here and what good I can do in the world and how everything lined up, timed out perfectly. Like my dad and I kind of hit a rough patch for a few years, and he was the one who had to take me to all of my appointments afterwards. And that gave us a chance to rebuild our relationship and get closer again. So then several years later, when my mom developed dementia and he needed help taking care of her, it was seamless for us to come together
Yeah.
and take care of her until she passed in 2023. I luckily, because of my life and everything that happened, I was freed up to come help take care of her as well.
Yeah.
If my life had been on the journey that it was before the wreck, there's no way I would have had time to come back and help with all those things. So time, space, believing that, yeah, I guess everything does happen as it should in the way that it should. Um, just takes time.
Yeah, no, that's a good answer. Yeah, and I would add to that, I found that one of the beliefs I hold strong to is to not stop. Now,
Yeah.
I say that by saying that what I did initially wasn't the best way. And now I've learned, like this mental health journey, to not stop. You know what I mean? So it's like there's a good and bad, and how you view that.
Right.
It doesn't mean run yourself ragged. It's stay the course, just try to take it day by day, step
Right.
by step. And, it ends up working itself out.
That day by day thing is good. One of the things I hate the most when people ask is, what's your 5-year plan? What's your 10-year plan? I'm like, I'm just trying to get through today.
Yeah. Yeah.
Let me get through today and see how I feel tomorrow. It's one day at a time at this point.
Yeah. It makes me think of, you know who Mitch Hedberg is?
Yeah.
When he's like, when they ask, what do you plan on doing in 5 years? Celebrating the anniversary of you asking this question.
Yeah, right.
This is the last question for right here. If you could give a piece of advice to someone who may be watching this, going through this right now, whether they're at home or in the hospital, they're watching this, what piece of advice would you give them?
Don't panic. Don't panic. You got to be patient, but everything's going to come together. Don't give up. Don't freak out. My husband used to tell me all the time, don't panic. I'd freak out about one thing or another. But yeah, I think if you can sit back and look at the bigger picture and look at your goals, where you want to go, realize it takes time to get there. It doesn't all happen overnight. So don't panic. Take your time. Get involved with the community. You'll get there.
Yeah. Patience. That's a good
It's huge.
Yeah. We all struggle with that.
Yes, we do.
So there were no judgment here. It's like, hey,
No judgment at
we've
all.
been there. That's what we're saying. Do the work, take your time.
Right.
Listen to the physical therapist.
Yes.
Even when it sucks.
They're usually right.
They can break you.
They can.
All right. So while I've got you here, we recorded this podcast that's in a gym.
Yeah.
Like we're in an office section of it. I want us to work out together.
Put me through the
Do
paces.
some stuff. 'Cause I love to see how you do things and how I do things. Yeah, I'm really just interested in seeing you moving around and asking more questions about how you do everything.
Yeah, sure. I will tell you, I have not worked out very much since this last surgery, so I'm on the weaker side, but I'm excited to get out there.
I'm not going to set you up for failure. I'm not going to make you look bad. I don't want to look bad either.
No, do it. Put me through it. Put me through it. I'm excited.
Yeah. If you want to see the workout and the rest of our conversation on the YouTube channel, it's Iron and Insights. So check it out.